Insomnia, by definition, is a sleep disorder where one has trouble falling asleep, staying asleep, or going back to sleep after waking up at the middle of the night, or all of the above. It is the most common sleep disorder in the world. Hi, my name is Brilliant. Welcome back to my channel. In this video, I'm going to talk about the types, causes, symptoms, and treatment of insomnia. To begin with types, there are two main types of insomnia. There is transient acute insomnia and chronic insomnia. Acute insomnia lasts less than 3 months and usually goes away on its own. Chronic insomnia lasts for more than 3 months, occurring 3 days or more every week. This one responds to treatments. Moving on to symptoms, we have daytime fatigue and sleepiness. Insomnia disturbs the body from reaching the restorative stages of sleep, hence the tiredness. This may result in sleeping at work or at school. Number 2, we have decreased concentration at school or wherever concentration is needed. Attention is affected similarly. Number 3, we have heightened irritability resulting in tantrums or poor social skills and relations. Number 4, we also have anxiety and depression as signs and symptoms of insomnia. Now I'm going to talk about the causes of insomnia. Causes include, number 1, anything that triggers your brain to worry. Examples will be an exam, unfinished work, stressful relationships, a physical pain, or even a snoring partner. Number 2, we have a disturbed sleep schedule. An example will be a long flight. Number 3, when you fail to sleep for a month or more, your bedroom may become your source of anxiety. It triggers your worry about failing to sleep and the restless nights. The insomniacs can be so stressed that their brain takes over the stress system, making the body assume a flight or fight condition. Due to the flux of the adrenocorticotropic hormones, the brain will become so aware of its surroundings, hunting for any potential source of danger. Any slight discomfort will be impossible to ignore. Insomniacs will end up twisting and tossing in bed, trying to kill each and every bed bug or trying to assume a position of comfort. Number 4, the daytime sleepiness, anxiety, and depression also causes insomnia, leading to a cycle which sees the insomniacs failing to sleep over and over again. Number 5, reduced estrogen and progesterone, common in menopause, also causes insomnia. It might seem like a small issue, but insomnia can be so serious a problem that it leads to self-medication, like the use of benzodiazepines and alcohol. This is very dangerous because it leads to dependence, addictions, and change of behavior. Insomnia can be treated through 1, good sleep hygiene, which can be prescribed by your occupational therapist. It might include sleeping and waking up at the same time, even on weekends, exercising, decreasing alcohol and caffeine intakes at night, avoiding daytime naps. Number 2, we have stimulus control, which entails using the bed only to sleep, taking out the bright lights, for example the overhead lights and the television. You can also use the eye covers and the earplugs. Number 3, we have behavior therapy. You can get assistance from your occupational therapist. It mainly includes relaxation techniques and cognitive behavioral therapy to manage life stresses and problems. When all of the above mentioned methods have failed, your doctor may prescribe medication. These may include melatonin agonists, non-benzodiazepine sedatives, and occasionally benzodiazepines. Obviously, medications have side effects, so they are recommended to be used for less than 2 months. So it is best to combine all these treatment methods for best results. Thank you for watching. If you feel that this video has been helpful, do not forget to subscribe so that you won't miss the next video coming up. Like and comment. See you next time.